Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. All right. So we're going to discuss a slew of things today.
Yeah.
I don't really have like a great setup for this, but it's just going to be a hodgepodge.
No, I think we're going to talk today about where our heads are at for 2026. So we decided, like with the team that I work on, we headed back to work in January. And again, we're basically through January now. And we decided 2026, we were going to level the fuck up. We're leveling up.
Oh, yeah. Same.
So like there's this energy about like, we're going to bulldoze whatever is in our way, which I don't even know what that is. But we're going to plow through it this year and just take it to the next level.
Just new stuff. Yeah. We actually had this conversation this week. Our goal is volume increase.
Yeah.
And I've spent, I don't know how many hours reorganizing, setting up every hour of every day for the 5 days of the week.
The most efficient way
I'm going to have to pull it up and show you. You'll love it. I really did a good job on this document. No, but I made some images that define the days of the week based on what we are doing the most of that day. So it's really special. The plan is what it's titled. Manic Monday with images. Trigger Finger Tuesdays. Wendell Wednesdays. Arthroplasty Thursdays.
TH, I get it.
And Fracture Fridays.
Wait, is that what you're hoping to see in clinic?
No, this is just like, this is my template for Monday and our numbers for that. Okay. How we're going to like stack our cases on the first, second, third, fourth of every, this is just, this is my brain on a piece of paper, theoretical piece of paper.
Now, I love that. I love that you're doing that. But do you also realize there's some of this that is not totally controllable? I mean,
why would you tell me that? Yes,
I'm just asking. I'm just seeing where your head's at with that.
I struggle with that. And that has been a big struggle for me this week. This is, I went through a roller coaster of emotions this week, and I was here at times and then I was here, and it would change very rapidly, and it probably got on everybody's nerves.
So do those around you, like on your team, know that you are like bringing the heat this year? Do they know that you're trying to level up?
I think if it wasn't apparent before, it is now.
Okay. Yeah. So are you expecting them to level up with you?
Oh yeah.
Yeah.
I have high expectations.
We keep making these declarative statements in clinic that we're leveling up.
Yeah.
And like the surgical rep that we work with, we just started like firing stuff with him on a Saturday, and he was like, what's this weird? You guys are working? Like, no, we're just,
this is the new us.
I said, buckle up, dude. We are leveling up. And then he like responded to that, but I didn't ask like, you with us? I didn't ask that. I just,
you are.
You are. Yeah.
Yeah. Come along for the ride.
So I took that energy into this week. So I was telling you, I don't know if it's today or another day, but I get up early and I have this like, I don't know, like 30 minutes in the morning where I should be doing like personal reflections, but I don't. I like social media scroll.
That is a personal reflection.
I like watch an episode of something, maybe if I have enough time. Like, I don't know. But I was looking at emails, which I don't wake up and I'm like, oh my God, I can't wait to work. Like, it's not that. I just so happened to look at this email and it like hit a pinpoint, it like hit a fire point for me. So it was this, this patient came into our urgent care and it was a 5-year-old, and the mom was like, hey, she fell, thinks she broke her wrist. Like, can you guys see that here? So of course they were like, yeah, I'm going to see a 5-year-old here. So the provider decided to get an x-ray, see how bad it was. So they get a suboptimal 1-view x-ray, tell the patient like, hey, it's broken. We'll probably have to reduce it, but she's 5, so she's probably not going to handle it well. Let me make a copy of her disc and send you out. So they did, and the patient left and whatever. So in the moment, I guess it happened. The feedback, the mom went on, Google, whatever she can, and wrote in two venues, like not just like.
Yeah, you can do 2 comments.
She did.
Yeah.
So, and 2 sites. She wrote a negative review, like, this place, they just took our money. Like, you should have told me you can't see 5-year-olds. So I like investigated. Yeah, this is 5 a.m. me. I'm like, let's see what this is all about. So I read the review. I looked to see what happened. I read the note, and I wrote back this response, and I was like, well, to be honest, it was 1 x-ray. Should have been 3.
Yeah.
Should have made a disc. Should have given it to them. Should have talked them through, this is going to be the next 3 hours of their day. Buckle up.
Yeah.
I'm going to no charge your visit. I will actually splint it for you because that's going to sit doing nothing until you're called back. But none of that was done. So in my email, I wrote back what should have been done. And then at the end, I was like, to be honest here, this is just laziness.
Yeah.
And so I sent it, and one of the other managers on the email like screenshotted it to me, and she was like, somebody woke up spicy today. Yes. I was like, well, I'm sorry. Like that person that mom wrote that review because you guys are fucking lazy.
It makes you spicy.
It makes you spicy.
Spicy.
Like, so I'm going to call you out. You were lazy. You should have done a better job.
Yeah.
I don't know what else to say.
I think,
guys, and that was Tuesday. Like that's how I started the week. Like that was Tuesday.
I had a great Tuesday. Tuesday went surprisingly well for me. And then Wednesday I was like, so I was here, and then Wednesday it was like, explosion of like everything. And
like in a good way?
And no, in a bad way.
Okay.
Yeah. Just like trying to, I'm sure you feel this way sometimes too. Like the more you try to manipulate as you see my plan, sometimes the less far you get. Like the more falls apart, the more you try to control, the worse it gets.
Oh, the worse it gets.
And I was like, I feel like I could work 16 hours a day. Yeah. I could work until 2 o'clock in the morning, and it's never gonna be right and good. And like, it's just not. It's not true, but I mean, sometimes it's me over exaggerating because of just an unfortunate snowball effect of things.
We had a surgery day Wednesday, which a normal surgery day is about 4 to 5 cases, and like again structured in a way so that nobody's like dying with the volume, right? So we had 3 cases, and then I committed the doc I work with to drive 1 hour north to assist on a 4th case. So executive decision, he's not going to do 5.
Yeah.
Right? On Friday of last week, the case that was going to be an hour away, there was no MRI, no physical exam. So the case was denied. I had to go to peer-to-peer. So I decided on Friday the case was going to be canceled.
Yeah.
I was not going to cancel it. I was going to let all the ducks fall where they needed to.
But it was going to happen.
So the peer-to-peer call happened Tuesday at noon. So now the plan would be wait till Tuesday and then scramble to make his day full.
Yeah.
Otherwise it's short. And then like, whatever. So what I did is I added a 4th case on Wednesday, overbooked Wednesday, assumed everything was going to be canceled. If it wasn't, then just the doc would show up an hour late to the surgery that he was helping somebody else with.
Right.
Totally gambled. Long story short, it ended because the patient got canceled.
Okay.
We had a full day of 4 cases. And I was like super proud.
Yes.
I was like really proud.
You won that gamble.
I won the gamble.
Yeah.
It could have been, it was an under, it was an over, but it landed exactly where I needed it.
I love that. I love winning the gamble. Yeah. I won the gamble Tuesday, and yesterday lost the gamble. Yeah. Although I didn't really gamble. It was like,
you gambled.
I did a little bit, to be fair, but my gamble was based on false data.
Okay.
Like, yeah. So, yeah.
I think though, again, I'm projecting, but I think like I'm coming in with a certain set of expectations that I've communicated with nobody, and they're a little bit higher than they were just 2 weeks ago. So, I was a little spicy this week. Like, I just want everyone to know that I have new expectations. I will share them with you eventually, but I also expect you to accept them. Yeah.
I think my gambles though are also based on like expectations of everybody living in the same space as me. Like this has to get done and there is no other option. So I'm going to make this gamble.
I know, but people don't see your view of this has to get done. I think some people, depending on what role they're in, are just like, whatever.
Yeah.
You know?
Yeah. It's not me.
So I like, again, for example, the extra case I added on for Wednesday was a case that required a specific implant. The guy was coming from however long away. I ordered the day in complexity, so he was the second case, right? So on the Friday before, added the case, and they were like, oh, is this a special implant? And I was like, yeah, make sure we get it there. So whoever got here on Wednesday morning for surgery, there was this text going around that like, hey, the implant's not here yet. We'll move that guy later in the day. I was like, I'm sorry, did everybody go home Tuesday and know that the implant wasn't there for 7 a.m.? They did. But nobody decided to do it then. You guys all showed up Wednesday, and then we're like, oh my God, it's still not here at 6 a.m.
Whoa.
Like, it wasn't going to be there at 6 a.m. if it wasn't there at 5 p.m. the day before. Like, why not make the plan? You know, like, I don't know.
There's always fluid change, and I'm fine with that. Like, I like that. I like to I like to play around with those things, but I like to have knowledge of them and like feel like I have at least pseudo control over
Nobody
it.
was with me on the level of like, I'm going to own this. Like no one was with me on that.
Yeah.
They were just like circumstantial.
Yeah.
Oh, well.
Do you ever feel like if you put in the level of care that you do and you're fired up about it, like you're fired up, you're mad that this isn't going the way that it was supposed to go, that everybody else all of a sudden is like, it's fine, don't worry, like things happen, it's like, okay. But if you were to have, if the roles were reversed and you had the lackadaisical, like, it's okay, like we'll get it, you know, it'll all work out eventually, everybody would be like, you like why don't you care and why aren't you you're lazy basically. But then when you try too hard you're like, oh, it's okay, it'll be fine.
I think there's a time and a place to say it'll be fine, and I think it's right when everybody's about to lose their shit, and I think it's your way of saying like it's gonna be fine, like don't freak out, it's gonna be okay. But when I am already like crescendoing and someone tells me it's gonna be fine, it just like exponentially like it's not gonna be fine. It's like when you're arguing and someone's like, calm down. Like, don't tell me to calm down. Don't tell me to calm down. Don't tell me to calm down. I'm not gonna calm down. Yeah. But I think if you're the voice of reason when it's needed, but I think if someone's telling you like it's fine because they see that you're going off the ledge, counterproductive.
Yeah. So
don't tell me
we rode the roller coaster of emotions this week, but it was overall fine.
It was great.
We went to the medical school on Thursday.
Okay.
To help with their anatomy lab. So that's fun. We do that usually, well, I say once a year. I've only been one other time, and apparently it was 2 years ago, not last year. I have no sense of time.
You've hit the quota once a year. You're done, apparently.
So this year it's done. But yeah, it's a good time because practicing now, I don't get a chance to be in cadaver lab anymore. And
did you have like the icks when you went back?
No.
Where you're like, oh, my nose forgot.
Well, I mean, my eyes were burning pretty quickly in. Yeah. But, I was enjoying the experience of my eyes burning.
Did you enjoy the experience of looking at the students being like, which one's going to pass out?
No, they're all good in that regard.
Good.
I did not enjoy going to sleep that night with still the smell in my hair. Like I was like, it's in my nose. It's embedded.
Yeah.
It's gone now, I think, unless I'm just immune to it and you can smell it.
That's good. No, I don't smell it.
But it was fun. It's interesting. Like anatomy lab was so long ago for me. I mean, it wasn't like that long ago, but it's just so far removed from my brain. It's really cool to like have the opportunity to be in that space. And then one of the girls that worked here as a medical assistant, she's in school there now. So I got to see her and hang out at her table. Yeah. But it's just so weird going back into that academic space where like, they're doing their dissections and it's all these like structures that I'm like, what even, like, does that even matter? Like this branch of this artery, I'm like, I don't know where that is or what that is or what it, like, maybe that's it. Everything looks like beef jerky noodles.
Yeah. Beef jerky noodles. Well, I did a shoulder lab, like a quickie, like 2 weeks ago. And like cadaver lab is the next best thing closest to the real thing, but it's also not the real thing.
Yeah.
You know what I mean? Like structures look totally different when they're preserved and dead than they are when they're alive.
Yeah.
So I don't know.
And like from a clinical
I want to know though,
like,
but I also want to know like where that artery goes.
Yeah.
I want to do that. I don't know
to be able
all of that,
to know more of those things. Right. Yeah. But I think for PA school, like everything is so sped up version. Like MSK dissections was not a big focus. So like we didn't, we probably spent a week or so on MSK dissections, but like we weren't really getting into the weeds of things. So we weren't like find Camper's chiasm in the finger,
I know. Quick story. So when we did cadaver lab, I remember having our cadaver test, right? So like you have all these dead bodies and you have a little flag with a number on it. Yeah. You have to identify the structure, right? Okay. So someone took a uterus and put it like right on the patient's neck. And I remember being like, I'll come back to that. Right. So I like, cause everything was like open where it was. Right. So I was just like, lung, spleen, kidney, whatever. And then I went back to that one and I was like, what? So then I'm thinking to myself like, thyroid, like, esophagus.
Yeah, like, do they have like a weird thyroid condition?
It's gotta be the thyroid that they like filleted open or something. So anyway, we went back and they were like, no, it was a uterus. And I was like, why the fuck would you put the uterus on the throat? Why would you do that?
Question?
Is question?
Yeah.
God, that was so long ago. I'm still mad about it.
Did they like actually count that wrong?
Yes.
I would think that would be like, oh, this was funny. Like we were just seeing who was paying that close attention.
Or like, let's throw that out. Yeah. They didn't throw it out. No, they didn't throw it out.
Oh my gosh. I've had much less thrown out than that. Anyway. Well, it was a good week all in all. We made it through. Here we are.
Yes.
So let's chat about some of the things, we want to get the hot gossip of these days is regenerative medicine and orthobiologics. And this is one of our passions for 2026.
It is. So like there's so much to this conversation and the depth in which we need to go. And that will absolutely be a 2-parter, but
3-parter possibly.
Oh, definitely a 3-parter. Yeah. I think what we'll talk about today is just like what is in our wheelhouse and what we can talk about in a safe, effective, evidence-based way. And again, I say it like that because I feel like there's a ceiling on our limits right now for various reasons, which is super annoying in our world because regenerative medicine is everything right now. If you guys have any type of like social media presence or in the fitness world or both, like it's there, and I want to be a part of it.
Yeah, because I see this as something that is like not only an adjunct, but possibly a better form of orthopedic care.
Yeah.
Not that I disagree with any of the, well, perhaps there's some things I disagree with, but not that I vastly disagree with current practice, but like, things are always evolving and changing. This is the new.
But I want to be that point person when someone comes in and I can do the whole, what's my diagnosis? What's my treatment? Like, how do I avoid this? How do I make this better? Like if someone says, how do I avoid tearing my other rotator cuff? Like I can talk to them about posture. I can talk to them about therapy, muscle imbalances, but I also want to talk to them about other stuff.
Yeah.
So, and I don't want to look at them with a blank stare when they're like, hey, have you heard about peptide therapy?
And me be like, what?
Yeah. So like, you can't do that.
I don't want to be that late to the game. I am with everything else, like fashion trends and everything, like the last to get, the thing. I'm like still wearing skinny jeans and flares are back in.
Yeah. I mean, skinny jeans are okay, but they're not widely accepted, as you know.
Yeah. Well, now, it was for a while. And I'm going to like go back to the wide leg as soon as it's not cool again. So I don't want to be left there in my professional world as well.
No, I get that. Don't even get me started. I have my hair still in a side part. My daughter's like, get over yourself.
I can't
get over yourself. My face is not meant for a center part.
I know. I don't think mine ever did well with that. But
anyway.
Yeah. What's okay. We'll be cool in this setting.
That's right. So the topics that patients will ask us most about, again, nobody wants to hear surgery is your only option. So how do you preserve something? How do I support my joints? How do I make my tendons healthier? So how often do you get that? Like
a lot, because I do think people like come in wanting to know some sort of root cause. Like patients want an answer for why did this happen? When somebody comes in for a trigger finger and they're like, well, why did I get this? Like, why me?
Yeah.
Unless they've got uncontrolled diabetes, I don't necessarily have like a great perfect answer for them. And even if they do, that may not be 100% why.
Yeah.
But yeah, they want to know a root cause and they want to know like what they can do that doesn't involve surgery.
For us, like a perfect patient is our teenage athlete. Maybe they're not teenage. Maybe they're someone who just is training for half marathon.
Yeah. Your weekend warrior.
They get like they're 5 miles in, 6 miles in, then they hit 7 miles. Like, oh yeah, my shin hurts. And then they come in and, hey, you have a stress fracture or you have bony reaction or, you're already through that process. And they're like, but what, like, how could this be prevented? Like, how do you feel? I mean, I can go on long, about shoes and change your terrain, blah, 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 but like supplements.
Yeah.
So vitamin D.
Vitamin D, that's a big one. And I feel like vitamin D is kind of one of the most, I don't want to use the word generic, but it's a very widely accepted
available
and widely prescribed thing in not just orthopedics and other specialties as well. So vitamin D, like the quick blurb I give people about it, because when people have fractures or something and they're like, should I take more calcium? I'm like,
they always say calcium.
If because that was like what people thought, the milk commercials in the 90s strong bones. If you
the milk mustache with the jeans. Like, I remember that.
Yeah, no, those are great. Well, we should switch it. There should be got milk. Yeah. There should be vitamin D ads instead.
Got cholecalciferol.
What's going to be the vibe of that poster? I'm going to print one out. That's ChatGPT's next project. Yes. But yeah, we talk about how vitamin D is actually more important because you're probably getting enough dietary calcium through, what you're eating, and the limiting factor is your vitamin D.
Yeah.
That helps you absorb the calcium. It helps the calcium actually do what it needs to do.
Yeah.
So more helpful for bone remodeling and fracture healing.
And patients will tell you I already take vitamin D. So when I prescribe a patient vitamin D, let's say it's due to a fracture, let's say it's due to a stress response, and it's an arthritic patient that has bone marrow edema, it's a runner who has shin splint, so they're in some phase of getting a stress fracture, I will put them on a ridiculously high level of vitamin D. So ridiculously high. Let's
what is your ridiculously high?
20,000 units a day.
20,000 a day.
20,000 a day. And then I'll titrate it down, 20,000 a day, then down to 10, then down to 5. So when someone tells me I'm already on vitamin D, I'm like, listen, in a multivitamin, 2,000 units, maybe.
Yeah, probably one, honestly.
Honestly, probably less than that. So I don't think patients have their head wrapped around what the dose should be. So and then I'll have the argument of do you get labs?
Do you test before? I was going to ask, will you before you do super high dosing?
If I don't test before, then I will do a 10,000.
Okay.
And also I don't test before.
So you do a lot of 10,000.
So I'll do a lot of 10,000. Yeah. If it's someone who then is but I already take, isn't that too much? Says the patient who came in with a stress fracture.
Yeah.
So
clearly
for
not,
you, no.
Yeah. So you don't get tests a lot. You said, what would you consider if somebody did happen to come in with a test, or if you did get one, what is your ideal range? Because as we all know, the ideal ranges are not widely agreed upon from a practice standpoint as opposed to the lab values.
Yeah. If the ideal range and what will be considered normal if you send it to the lab, it's anywhere from 20 to 80. I want someone sitting over 50.
Yeah. Yeah.
Anyone who has orthopedic pain that is vitamin D deficient, it's going to be under 50, for so much so that I would treat that.
Yeah. Yeah.
What about you?
I say 40 to 50 is the low level of
norm.
Okay.
Yeah.
If you're 40 or 50, you probably still should be supplementing daily with maybe, 5 or something. That's what I do personally. I haven't checked mine in a while, but, I think that is the low threshold.
Yeah.
And then my upper threshold where I'm all right, you probably don't need to be much above that 80 or so.
Yep.
Yeah.
And then patients will also ask, can you overdose on that? Yeah. I mean, too much vitamin D. Yeah.
It's fat soluble.
So, I will test them if we're going for a long period of time, or if there's a significant medical problem, let's say it's they did nothing and they fractured something, or I saw a 17-year-old girl, so a high school girl. She was really tiny. So looking at her, probably not a lot of vitamin D, just looking at her skeleton. And she ran into a table at school and fractured her kneecap.
Oh my God.
You have low vitamin D.
Yeah.
So I started her, we ended up fixing it, but I started her on vitamin D, and her vitamin D level was 13.
Oh my gosh.
So low.
Yeah. I mean, you get it from sun exposure.
You go outside.
Seasonally, it's going to be low. Yeah. You go outside. Also good for your immune system.
Yes.
So winter, especially vitamin D supplementation is important. So I don't know if I need to make this disclaimer. We're not giving medical advice, blah, 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 blah.
We're just pro vitamin D.
Yeah. We're pro vitamin D. You have to do what's right for you. Ask your doctor.
Ask your doctor.
Ask your doctor what's right for you.
But again,
only if they agree with vitamin D.
I know, and we're also talking about this though because these come up in our daily conversations, whether it's with patients or otherwise. So, I might change my protocol.
Yeah, I mean, I'm always evolving with these things based on what we see and what we find. So, we've kind of touched on calcium, whatever. I don't really ever recommend calcium to people. Never. I mean, unless somebody got labs and they were whatever. If you're super calcium deficient, there's probably something in the thyroid.
You have rickets.
Yeah. You're Victorian child.
So, I don't really talk about calcium.
Yeah, I don't want to talk about calcium either. This one I wanted to touch on, but I think it's old news, honestly. Glucosamine chondroitin. This is old news. I feel like when I started 10 years ago or so working in the other building, it was the hot topic at the time, and we were recommending it a lot. I mean, now, not so much. I don't know. What are y'all's thoughts on it?
I will mention it. That is definitely something that we talk about. I don't think it has to be this or not. I think if patients are looking for supplements for joint pain, glucosamine and chondroitin is certainly effective, right? But I'm also putting it in the meh category.
Yeah. I tell people like it can be. I'm not saying it's not helpful, but like I have some patients who have taken it and told me like, oh my gosh, I had steroid injections, I did blah, 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 blah. And then I took glucosamine and I started feeling better and I haven't needed anything in years. Yeah. And it works. And I'm like, great, perfect for you. This works. Yeah. But like, I'm not going to tell somebody this is your answer to life. Yeah. Yes, I still recommend it. We have a form that is our knee osteoarthritis core values, and it just core values. I love that.
Yeah, we're leveling up, Hannah. Come on.
Yeah. So
2026. So on our core value sheet, it is on there as one of the things. So it's not necessarily the thing. Let me see. Core values.
I love that.
We'll do patellofemoral
for patellofemoral. You have core values for multiple things?
Yeah. I have a lot of core values.
I love that.
But anyway, the supplement list. Oh God, this one's not on here. Did you see it ended with our commitment, like our commitment to you?
Oh my gosh.
Yeah.
Mm-hmm. Wow. This is leveling up. Okay, I'm so motivated. I'm going to go home and
stop. Sidebar. Talk about something else while I find this.
Core values for trigger fingers. These are my opinions.
Okay. Sorry. Core beliefs. Core values is patellofemoral pain. Core beliefs is knee osteoarthritis.
Why the different verbiage?
I don't know. I guess I should make it all the same, shouldn't I?
Well, I mean, values imply like, I don't know, versus belief. I like beliefs.
Yeah. But again, and it says beliefs because it doesn't say like, you must do this. Yeah,
I believe
you should.
This would be helpful for you.
Yeah. So anyway, so it's on our list here, definitely.
I like that.
Ours are a ton of other things.
Isn't
that crazy?
Yeah.
But anyway, so yes, it's on our list, but I put it in the meh category because I don't think like life is going to hinge on that. Yeah. Plus in my experience, when I was like really talking about it 10 years ago, you have to take it for 6 weeks before you feel anything. And nobody
actually does that. Yeah.
Everybody quits at 21 days. Like people just can't hang in there for as long as it takes. Yeah. But when they ask me about it, yes, I can talk about it.
What about collagen?
Yeah. We are now recommending that to patients like officially. And again, leveling up. Before surgery.
Okay.
Yeah.
For specific surgeries, like, for you do a lot of cuffs.
Any type of tendon thing. Yeah. So cuff, elbow, tower tendon, pec repair. Start it before surgery so that they can start themselves off healing correctly.
Yeah, I like that. I haven't in the past recommended a ton of collagen. People ask me about it. And it's one of those things that I wouldn't say it's in the meh category. It's like above the meh category for me. But
what's that category?
That category is like, well, I can see, like I could be convinced based on the data that this could be helpful, but not enough so that I would like bank my life savings on it.
Okay.
So.
Okay.
Yeah. I mean,
so you're mid? Is that what like we can
mid?
Call
yeah, that's mid. The cool thing. Yeah, very mid about collagen.
Okay.
But again, and this is what I tell people, like, it's not going to hurt you to take collagen supplementations. It might help. I'm not going to sit here and say like you're going to heal this much exponentially faster by taking it. But like maybe if you're, deficient or whatever, it will help you not take longer. So... Is that a very mid explanation?
It is a very mid explanation. Yeah, that's good. So we do recommend that, especially if we're looking at, trying to heal something better than, time and all the variables that go into when someone doesn't heal correctly. So building block for proteins. And I think that, again, if we talk about categories of things that are studied and evidence-based, collagen checks the box.
Collagen checks the box. And you touched on
dangerously close to like amino acids and peptides, but it's still within parameter. I know.
We'll get there.
Yeah, it's still within parameters.
Well, you touched on protein, building block of protein. So protein, I had here on the list somewhere down here as a supplement of sorts. Like we can consider protein a supplement because it is, in order, my personal thought, in order to get enough protein, you're going to have to supplement it in some way. Unless you just eat a ton of grilled chicken for every meal.
Yeah.
And I just can't.
I will tell patients, and again, like recommendation is 0.8 to 1 gram per body weight. And again, that's like fitness me talking.
Yeah.
I'm also like orthopedic me talking.
Yeah.
But I will tell a patient that. And for my 200-pound men, they're like what?
Like, how am I supposed to do that?
Yeah, you're right. You're supposed to protein shake. You're supposed to eat a crap ton of chicken.
Yeah.
Fish. Like, I mean, eggs has such little protein, but everybody puts that in the category.
Yeah.
Eggs, throw some egg whites in there. Like, I will talk a little bit about that, but I'll say, listen, I will tell you right now, you don't have enough protein.
Yeah. You can tell looking at someone if they have enough protein or not.
You can.
But it's tough to get. Like, I mean, I have to track most every day. I've gotten to a point where like I can kind of guesstimate where I'm at without tracking some days, but it's hard to get that level of it without supplementing it. And, you know, like you said, I base the 1 gram per pound of body weight. That's like kind of my low level threshold.
Yeah. Or ideal body weight. I'm not talking about that, but whatever. Yeah.
So yes, protein, very necessary, especially the older you get too, because your muscle is just basically every year I age, my muscle is just like wasting away so much harder.
Every day that you age, you're disintegrating.
I'm disintegrating slowly. Plus my distance running. I mean,
you're
shriveling.
You're prune sitting next to me.
I'm picturing was it in Beetlejuice or something, like the little shriveled. Yeah,
the guy with the small hair,
or like I don't know, SpongeBob. There was like the little shriveled guy on the wheelchair. Yeah, that's what I'm turning into every day.
But yeah, protein is essential, especially if you're undergoing a surgery where like the demand or the insult on your body is more, and you need that for healing.
Yeah,
it's like patients who are sitting in the hospital and they just like literally disintegrate. You have to increase your protein diet.
I mean, yeah, that is actually something they even teach you, like high protein diet for the people disintegrating in the hospital.
Back to collagen for a second. So talk about vitamin C with collagen.
Okay. So what is that? Like, do you recommend it with it? Yeah. I read that on there. Like it helps, I guess, with its function or absorption or something. What's the deal?
Essential for collagen formation. So it's like a stepping stone for collagen formation. So if you have collagen, you should have vitamin C, just like calcium with vitamin D.
Yeah.
So those two things kind of go together.
Okay.
So vitamin C improves tendon healing, bone healing. Again, in conjunction with collagen. So a collagen supplement that has vitamin C, good to go. But I'll normally tell patients like, get something like powdery that you can put in your coffee or something.
Like the Vital Proteins collagen powder. Ooh. Yeah. Brand, are they going to sponsor us now? Because I said their name.
Mean, we can. Okay. I mean, hopefully.
So how about natural anti-inflammatories? NSAIDs are something that we very commonly prescribe. Yep. I mean, every day. And there's definitely risk with them. Not great for you for a long-term perspective. So natural anti-inflammatories, biggest one that we recommend to people is turmeric. Yep. And it acts on similar pathways to actual prescription anti-inflammatory medications. Yep. So it does have some proven benefit. You do have to be on it for longer to notice that benefit. But you certainly can get good anti-inflammatory benefit from turmeric with black pepper to help with the absorption. So I'm going to tell you on our core value sheet, and again, I'm just going to rattle these just so you know, like the length. I don't look. I can't. Oh my God. No, but anyway, so omega-3s, turmeric, ginger, cinnamon, quercetin, coenzyme Q10, N-acetylcysteine, melatonin, berries, tart cherry, garlic, black pepper, probiotics, alpha lipoic acid, boswellia serrata, magnesium, zinc, vitamin C, and green tea. Like what? The boswellia, yes. Boswellia, NEC, quercetin. When I was on like my crazy supplement kick, I was taking all of those. Yeah. So like when I know it's time to hand out the core values and core beliefs is when patients are like, oh, I don't like taking anti-inflammatories. You're like, and then I get like cozy. I'm like, and they're like, wow. So I think, do you need to take all of them? No. Are there certain natural things you can take that will decrease inflammation? Yes. Yeah. So I think knowing, like dipping our toes in that water to understand that we can have those conversations. I think I would rather be the person to provide that advice because I have wrapped my head around it versus they go on Amazon and just click, and then they click this, the ad tells them to buy that. Joint support supplement on Amazon, which is probably glucosamine chondroitin and But anyway, so I think if you had to pick two, two for natural anti-inflammatory benefit. Yeah. Turmeric, and I guess like the things I had read about the boswellia was more for osteoarthritis benefit. Is that what you? So I guess it depends on what I'm trying to this one it with. Reduces CRP, which improves your osteoarthritic symptoms. But so I guess for OA, those would be like my two main ones. For like a generally healthy individual, turmeric, I think, is probably sufficient.
Yeah,
you know,
it's easy. Mm-hmm.
I don't take it myself, but perhaps I should. I don't know.
Are you inflamed?
I think so. Probably. Okay. One that I like to touch on, nerve related things of nerve related benefit. So I'm big on the B vitamins because B vitamins play a huge role in nerve recovery, and neurotransmission and healing. So
what do patients though, like, what is their reception to that? Like when they're like, my hand's on fire, or it falls asleep when I'm driving or sleeping or whatever, and you're like, here's some vitamins.
Yeah. So I don't necessarily do that. So like say somebody comes in presenting with classic carpal tunnel symptoms. Carpal tunnel is a compressive issue. So like, I'm not going to tell somebody we can fix their carpal tunnel syndrome with vitamin supplementation.
Yeah.
You won't. I mean, you can fix it with surgery. And this is one of the fewer-ish times that I'm like, surgery is not like a last resort option, right? It's a pretty standard, pretty, relatively quick recovery, safe surgery. So if somebody needs a carpal tunnel release, just go ahead and do it. That's the only way to really fix it. But vitamin supplementation can help augment their recovery. Yeah. So say they've got really severe disease, maybe starting it beforehand, continuing it afterwards just to help augment with that. Non-compressive, like non-true compressive peripheral neuropathies can benefit from vitamin supplementation alone. So I'm recommending these a lot to patients who like come in with maybe not so classic carpal tunnel symptoms. Their nerve test isn't showing true or severe disease. I'll ultrasound them and the nerve doesn't look inflamed, but they've got kind of, they've got somewhat carpal tunnel-y symptoms, maybe other nerve type symptoms. Well, they're a great person for recommending vitamin supplements.
Or I've got a weird subset of patients that we'll see for like lateral epicondylitis, but it's really kind of also their radial nerve, and radial nerve doesn't really show up on EMG unless it's really bad, and then it does. So those patients, I like the vitamin talk. And again, I have a vitamin. It's this vitamin D is on here, but it's okay. The B12 and the C, I have like a whole thing on here. I don't even know when I wrote this.
Yeah, is that doesn't have core values listed at the top of it.
This is like
it's not ready to go yet.
This is circa like 2000.
Oh wow, this was the early stages.
So I've been on board. Believe it or not.
I love that.
I've been ready for this conversation for like 5 years.
Oh, well, this was a perfect topic. Yeah.
Yeah.
So yeah.
Or even like patients who are post-op who still have the residual things.
Yeah. Or so like, the post nerve block.
Yes.
Patients.
Yes. Oh my God.
Gosh, what was that? Why can't I think off the top of my head? Cause that was wasn't that a B vitamin? The gummies, riboflavin. Yeah. Right?
Yeah.
Yes.
Yeah.
We were recommending that for a while. So yes. And sometimes you can get neuropathic symptoms just truly from a B deficiency. Yeah. So everything's not adding up and making sense, and we'll test those levels and maybe they are deficient.
But yeah, that one I think, again, just to be like thorough with what you're doing. And I think so much that we go down the line of like carpal tunnel fix or, not bad carpal tunnel inject, but then these vitamin supplementations I think are huge. So again, for any PA that's like in that world, just like get a basic knowledge.
Yeah.
Right?
Yeah. I mean, because people are going to ask you about that stuff more so now.
You don't want someone to ask you and you're like,
I don't know.
Or, oh, thanks. I didn't think about that.
Yeah.
And then the review says, I had to ask them to give me supplements to fix my carpal tunnel.
I know more than them. Like,
I know more than them.
Why didn't they just give me my money back? Yeah. That and alpha lipoic acid.
Yes, that's on my list too.
Yes, love that. So, that in conjunction with it. So, this is good for neuropathic pain. They use it mostly in diabetes, or they use it a lot more in diabetes. Reduces oxidative stress, blah, blah, blah. So this can be really helpful for, again, diabetic neuropathy. You can also use it for, weird nerve pain post-operatively. Yeah. I think it has good benefit for that. Or, like maybe like a CRPS type situation.
Would you sub in B12 or alpha lipoic acid for gabapentin?
Yeah, I would. I mean, sub in or in conjunction with.
Agreed. Yep.
You know, some people don't tolerate gabapentin well. We have one patient that did a proximal median nerve release on. And unfortunately just like was not getting better. Actually, it was like getting worse afterwards. Revised it just to make sure that everything looked good and fully released, because like it just was not, she was not progressing like we expect. Everything was fully released, fine, but just kept presenting with worsening nerve pain. And we've tried everything in the book at this point. I mean, I did want to try alpha lipoic acid for her and some of these other supplements, but then you get into like a CRPS type situation, maybe something like that going on, the small fiber neuropathies. So,
but I think it should be in your wheelhouse. I think if it's not, I mean, again, you shouldn't wear a t-shirt that says like, ask me about supplements.
Ask me about your B12 deficiency.
Ask me about your B12 deficiency. Yeah. But I do think that it has to be in your wheelhouse. You have to be able to talk to that, because some patients just don't want to take this or don't want to take that. And you hit right with the right patient, and you're amazing.
And I'm just going to touch briefly on one of my favorite ones, magnesium. I think magnesium has a lot of benefit, not just orthopedically, but in general. Helps with sleep, muscle relaxation. We recommend it a lot to people with like cramping sensations. Can also help with nerve type symptoms and pain. And, you know, if you're not sleeping well, you're not recovering well, you're not regenerating muscle, you're not healing. So, I mean, I think of like healing from a surgery the same way as I do recovering from a heavy strength workout session. So you're breaking down muscle in order, like you need that restful period and that growth hormone release to repair it. Same thing as you're recovering. So if all of these things are stacked against you.
We also have another sheet, and again, it's like blowing your mind.
I love it.
So sleepy time supplements. So magnesium is on that list. So you'll have patients that for whatever reason, especially rotator cuff world, they can't sleep because their shoulder hurts, or post-surgery world, they just can't sleep, whether it's medial knee pain or it's their rotator cuff they're healing from. So very easy to go down the road of like, here's some Ambien, or, you know, you can drink some whiskey.
That's what I mean, like in combination with
disclaimer. No, but instead of adding like more prescription drugs that have more side effects, magnesium is like a go-to, like that. Melatonin, we've got tryptophan and taurine on the list too. So we'll hand this. It's our sleepy time supplements.
Do you take any sleepy time supplements?
That's funny you say that. So I used to rely on magnesium. Not rely on it, but I was like into
consistent.
It. Yeah. And I was just like in my bathroom the other night, and I saw the bottle in the back, and I was like, I've been taking that in like 6 months.
And you haven't felt like you needed it?
No, I'm sleeping like a champion right now.
Oh, nice. God, I'm jealous.
No, I am. I'm in a phase right now where I'm sleeping like a champion, and I don't know what it is.
Yeah. Well, I will go through the phases
choices,
sometimes too. Yeah. Life choices will contribute to it, but like, you know, stress levels and stuff like that.
Yeah, I mean, I have to get appropriate. I'm not sleeping long. Like, don't misconstrue.
What is your typical
length of sleep?
Yes.
Like 7 hours.
Okay. Yeah. Same. I'm like 6 to 7.
Ish.
Which I feel like for me, like I don't feel bad on that level of sleep. I feel like I can function. Sometimes I question it because I'm like, would my recovery and like progress in things be this much leveled up if I could hit that 8?
It would.
Possibly. I'll never know because I don't think I'll ever get there.
Yeah. Well, so I intended to sleep late this morning, and I was
you
just
can't.
up. I cannot. No, I was just up. I was closer to 8 hours, but I didn't quite hit it. And then I tried to go back to bed to like make myself hit it, and then I was just like what time is it?
Yeah, like it can't. You can't just fall back asleep. You can't force yourself. So.
No, but I think restorative sleep, we should have knowledge and verbiage for our patients, because again, like everything, like you can't go back to work if you're not sleeping, your tendons can't heal if you're not sleeping, your inflammation is going to be out of control if you're not sleeping, like
you're going to be yelling at me if you're not sleeping. I'm going to walk in the room and it's going to be tears as soon as yes.
And then next thing I know, I'm hearing about your sister who never loved you. Like I get it, but like you know, you got to sleep.
I think you're just not sleeping
but
well.
Just to be clear, magnesium is not all the same. Different magnesium components. Some help with constipation, and I don't want you taking that before you go to sleep.
Yes.
So educating yourself, being a provider on what is
glycinate
good, what is not.
is the good one, in case anyone was wondering.
Yeah.
Not that the other ones are bad, but again, different uses for different purposes.
Yeah.
Okay. Yeah, I think this is a good touch on like the things that as of right now we can feel good about making recommendations or suggestions on as providers.
Yes.
But I don't even know that I would as much lump this in regenerative medicine as much as it's more touching on like a more holistic approach.
This is more holistic. This is also safe. I feel fine rattling off about supplements.
Because you can go to Vitamin Shop and get it on your own. Yeah.
I have opinions about supplements. I can educate patients appropriately. Where I really want to go with this conversation is regenerative medicine and what that looks like and how I can get into that like yesterday. But that'll be next time.
Yeah, that will be next time.
This is the world we live in, and you guys should do that. Like, it's not all about pharmacology, because again, it turns patients off sometimes. Yeah. And speaking about turning patients off, if you give them a list of 65 things to take, they're going to take 0.
Turn off.
Also a turn off. So what's your like max? Well, you see a patient for a nerve,
yeah, because it depends on what they're coming in for, right? And like what they're complaining of. Like maybe for somebody who is pre-op severe carpal tunnel, cubital tunnel, severe axonal loss, like I'm going to recommend B12 supplementation prior. Maybe magnesium to help with like cramping and nighttime symptoms and things like that. Somebody comes back post-operatively and they're having a lot of like out of control weird nerve pain. Yeah. Alpha lipoic acid is probably a better choice for them. Fractures.
Yeah.
Vitamin D.
Yeah.
Yeah, like it really just depends on what their specific concerns are. As a general rule of thumb, I think vitamin D is probably like my most used and talked about you need for everyone.
For everything. Yeah. Every patient should take that if they're seeing you, because we're in the orthopedic realm.
Yeah, that's the one that I am most consistent about. Therefore, I feel that everyone should be the most consistent about.
Yes. Good. So, do you treat patients differently based on their desire to want to know more? Like if you know the patient's there ready for it, then they're getting your full list.
Yes, because I just get more excited in those visits because I feel like they care about what I'm saying.
Here's another handout.
Whereas there's some people that I'm like, oh, this, and this. And I'm like, I can tell they're not interested. And they're like, but like, what can you prescribe me to help? I know. And I am still going to talk to them about those things, but when they're not as interested, I don't get as passionate about getting into the weeds of it. If somebody is really passionate about it and like, I'm into, like, I don't want to take the prescription stuff for this.
And then next thing you know, you're telling them like where you get yours. So that
and then we're talking about like our workout programs and like what you,
then you get a good review. Like
then we're like best friends. And I'm like, I leave the room. I'm like, I love that person. They're great.
So will you equally, like, how much space is there in your world for like, I say red, white, and blue because I heard that so many times this week when someone was referring to Medicare. That's not what I want to say. But like, where is there a space in your world for like prescription protocols and supplements? Are you 50-50? Are you 80-20?
On like,
or that changes, like for recommendations, like for
whether I use prescriptions versus supplements.
Yeah, like will that change every room you go in? Because it does for me.
Yeah, no, it does. It depends on the person and like the situation and what I have already tried in the past. I still am like pretty, I don't want to use the word reliant, but I do use things like gabapentin and steroids more regularly than recommending supplements. Because I mean, we all are victims to wanting quick results. Yeah. Like the patients do, and I do too. Yeah. So like if somebody is having a significant amount of post-op swelling, like if we have a distal radius fracture and they're coming back super swollen, their hand's a balloon and they can't close their fingers and make a fist yet, I am not going to just tell them to start taking turmeric and wait for it to work.
Yeah, see how it goes.
You know, they're getting a bunch of steroids and stuff too. And maybe turmeric is a good thing for them to also start taking and beyond in general. But that's not where my mindset is at that time with that person. Somebody who comes in with like this chronic low level inflammation and like all these tendinopathic things. You know, they're a better like, let's start you on this. I'm not super excited about just treating you long term on low level steroids.
Do you ever have a patient come in where they hold you responsible for not recommending? Like I randomly see these patients that have these like novel, you know, realizations, and they're like, I was talking to my friend at the gym, or I was talking to my primary care, I was talking to my friend at church, and they said I should be on collagen. How come you never recommended that for me?
I mean, I get myself into those situations sometimes because because again, like I don't like, it's not something I recommend to every person. Yeah. And I mean, we'll talk about it and I'll tell them my stance on it. And I'll say there's just so many things my mid response on collagen.
Mid for me. Yeah.
We're here.
I have omega-3s they're somewhere between mid and meh for me, and it's personal. My husband used to take that because he had like, I think he had high triglycerides or something, and he used to take the capsules and like just didn't want to take them in the morning because he didn't like the taste of them, so he put them in his pocket, and that went through the wash like 3 times.
Ooh, yeah.
So I have a personal association with fish oil that I can't dissociate. So every time you say that word, I'm like,
no,
I shudder a little bit. Yeah. But it is helpful. But I find myself personally having trouble recommending that.
Because of your experiences.
Trauma.
Yes. Trauma. PTSD from your omega-3 capsules. But I think this is all really good stuff to kind of have in your back pocket and front pocket.
Yeah, all the pockets. The one where I keep my pen right there.
Have some here.
Just not before you put it in the wash. Don't put it in that pocket.
Yeah, do not put it in your washer pocket.
Wait, real quick. Do you think that PA school went into this realm at all?
No, not at all. We did not talk at all about like...
No.
And I'm trying to think, did we maybe talk a little bit about like holistic approaches to things? I don't think so.
No, you didn't. I didn't.
Yeah.
There was nothing in PA school. This is all just living in the world and seeing what people kind of want to talk about. And then me personally, like diving in, making some handouts. Like, I mean, this is just how we are tailoring to our patient population.
Yes. Yeah.
And again, lead into, next thing when Paige is going to come now and ask me all the time about peptides.
Yes. Are we going to get into that next week post party?
I don't know. There will be some talk about peptides, you guys, because we're leveling the fuck up this year.
Yes. 2026 here.
We're
here. Through the fucking roof.
We are through the roof. We're going to talk about injecting people with their own fat too.
Oh yeah.
Yeah. I know.
Yeah. We'll do a little PRP, bone marrow.
Yeah.
All those things. Yes.
All that. When we go on our conference, which by the way, I asked you to go to, and you said you were never, quote, I've never been more committed to anything. And I gave you no details. All in.
All in.
That was the day that I knew that Hannah was also going to level the fuck up this year.
Oh, everybody level up with us 2026.
We will talk more about orthobiologics and all the things that hopefully we are going to be bringing to our practice.
I said we might have to do
maybe that's the time we get our rep on.
Yes. Yeah. Well, I said we'll just have to do one from Naples.
Oh, totally. We're taking this shit on the road.
Yeah, take the show on the road.
Yeah.
All right. Until next time, guys.
All right. Thanks. Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.